with that, we move on to our next talk, and it's really a privilege and an honor to introduce Dr. Habil Khorakiwala. Dr. Khorakiwala is the founder and chairman of the Wockhardt Group, one of India's foremost pharmaceutical visionaries with over 5 decades of leadership spanning pharma, biotech, drug discovery, and healthcare innovation. Under his leadership, Wockhardt has emerged as a global leader in antibiotic drug discovery, becoming the only Indian company to receive 6 qualified infectious disease product QIPD designations from the US FDA. In contrast, other global pharma companies have only received 1. He's the former president of FICCI, and currently he's the chairman of FICCI Life Sciences Council. Dr. Khorakiwala has played a pivotal role in shaping India's life science ecosystem. Without further ado, I would request Dr. Khorakiwala to kindly share his views, and his topic is the journey to global leadership in antibiotic research. Thank you. Dr. Khorakiwala.
Very good morning to all of you. You heard just Dr. Renu Swaroop, and I must say she played a very important and pivotal role the way we manage COVID in the country. And I think all of us should be proud of her leadership and the government leadership that we can do, because that's the kind of a spirit. I was pleasantly surprised some time back. Dr. Vinod Mattu came to meet me because he was with us many years back, 40 years back or so, 35, 40 years. And I must compliment him and the team of Sunila and others who have taken this leadership role in talking about research, building an ecosystem for research. And I wish that all of you, most of you are scientists here, or leaders in science area and research. And I think this is an area and a movement one must continue, because what I'm going to share with you about our research, antibiotic research, is a demonstration that India can do it, we can do it. And that kind of a spirit, I think we should all move forward. The other aspect, coming back to the area of our interest on antibiotic, today, number of people, this MDR resistance is so widespread and so understood. Just to give you some numbers to get the enormity of the problem. During COVID period we just talked about, India lost 500,000 people, world lost 5 million people in 2 years. Today, because of multi-drug resistance, say in a 2-year period, world is losing about 20 million people. And we are losing about 1 million people. Not 1 million people, I got my numbers wrong, but it is 4 times more than the COVID incidence. So this is the enormity of problem, and that is what one is not recognized. And therefore one wonders why this has happened. It has happened primarily because 28, 30 years back, when we were looking at developing a research program on drug discovery, at that time, of my perception after studying market, visiting some of the research organization where Indians were working, understanding the complexity of it, that I came to a view that amongst all the therapeutic area, it was antibiotic, where big pharma are toning down their research program when I look 20 years back. The other element which was there was, okay, we have to recognize, because many companies started, we were the actually late starter in putting up a drug discovery program by 2-3 years. But another 4-5 companies, as you know, started drug discovery program. But the thought which I had in mind, I didn't want research as a business. I want the research as an enabler to building a business. So if we have to do that, we need to be competitive in the research we do. And there is no way we could be competitive in terms of resources. Financial resources, where there are billions of dollars were spent, we don't have India or anybody has, nor our ecosystem. We don't have the scientists, we don't have the know-how how to do it. So therefore, it is very difficult to compete and be a leader or successful if you don't build up a research program or identify area. So we decided antibiotic, there is a possibility, in the sense that in everywhere 10% of pharma business is antibiotic. And second, obviously, if big guys are exiting slowly, my assessment was get 10, 20 years, there would be hardly any research going on big pharmaceutical, and that's a reality today. The second important aspect is that I thought that even if my research is not good enough for global market, India and emerging market is a big opportunity there. And obviously, the price points available, one can penetrate that market. So I had a business purpose for drug discovery research, not the research per se. So that was the main driver. And then obviously, we built up a team. Our leadership, Dr. Mahesh Patel is there today. He has been there for the last 30 years plus with us. He worked in multinational earlier and had that experience, but he came and told me very early, I asked him, how are you going to build the team? And his first response was that I'm not going to go after people with experience. They are all available, even in India, but I'm not going to do that. He says, I will go ahead and find the best competency, knowledge, scientific go to university, select amongst the best. And that is how we build the team. And that is still he's building a team on that basis. And my top leadership team in research over the last 25, 30 years is intact. There is no attrition. Even as a whole team, the level of attrition, even at junior level put together, is small. So one important aspect is drug discovery research is a very multidisciplinary approach. There are at least 12 to 15 areas one needs to concentrate and develop expertise, like chemistry, microbiology, pharmacokinetics, toxicology, so on. So there are, and to build up that capability to be competitive is by itself takes time, and it took us about 8 to 10 years to build up slowly this kind of competency. And many people ask me from time to time, okay, what is it which made you went on staying on the course for such a long period of time? In spite of the fact that we had gone through as a company financial challenges in 2009, 10, and last 4-5 years. So we had to make a choice every time, what is the purpose we are there for a long haul of time. And that is where the confidence came in this, and that is important. It's not just the vision, it is not just you stay a course for such a long period of time. You cannot remain on course unless you believe from time to time that you have likely to succeed. So what I have been doing personally for the last 15 years and more, that our team had built up a very nice, 2 or 3 things they did. One is they built up a nice collaborative of various academic, university and other institutions to do a part of the work, because you cannot have everything done in-house. So about 30 such arrangement was there over the years. The second aspect is they attended literally every conference which we, scientific conference worldwide, in US, Europe, 2 or 3 a year. And not only they attended, they take some of the scientists along with them in that area wherever the work was there. So one was available with the current knowledge of that. So these were important, but more equally important for me was they were having this KOL meeting in various areas of specialty from time to time, literally once a year or once in 6 months. And these are roughly a 3-day scientific meeting. I know science, I'm not a hardcore scientist. But I sat through that meeting, and about 7 or 8 such meetings over 15 years. And that is where one gets a perception that what we are doing, what our team is doing, is globally unique and competitive. And I think what we have achieved is, just give you one example. Our Xenic molecule, which is for gram-negative, it works in all gram-negative, that is Pseudomonas, Klebsiella, Acinetobacter, Enterobacterial, all areas. So there is an institute which gives a break point in antibiotics. And it is well known that the higher the break point, the more effective is a drug, the safer is a drug. So this institute is CLSI, that is a clinical laboratory and standard institute in US. They give this kind of a break point. Since penicillin, 1928 was discovered. So 98 years, about more than 300 antibiotics are approved and are available worldwide. CLSIL gave us 64 breakpoint for Xenic in all the organism where it is susceptible, and it covers literally everything in gram-negative. Last 15 years, no antibiotic has been cleared by regulators in US and Europe with more than 8 breakpoint. Nor in last 98 years, any antibiotic has been cleared with this 64 breakpoint. So when we said there was a penicillin moment then, today you have a Xenic moment. So that is the, now this is mainly, it's a new class of a drug also. It is enhancer, beta-lactam enhancer, and that is it. And we have totally got 6 of our drugs. US FDA gives a QIDP, that is a fast track, and that is only in antibacterial, and that was mentioned initially. No company received more than 1 or 2, including Pfizer, Glaxo, or any other company today. So we believe that we have got end-to-end capabilities for, in antibiotic space, drug discovery on one hand. And in terms of the results achieved, number of products, it is quite phenomenal because all these 6 drugs, they are not overlapping. They are each have a different therapeutic space. And that was my contribution, if at all you want to know which area to focus. Other than the whole achievement is by our scientific team. And we build up clinical capabilities, having people from US and Europe. But the drug discovery scientists in India, over these years, they were all from Indians. At no time we had anybody who is not an Indian as a drug discovery. But obviously in clinical area, we have a global team because we have to do a global program on that front. So from that point of view, if you look at all these elements put together of what we have done and this 85% of today's multi-drug resistant cases can be dealt with 6 of our products put together. So what we are there as an organization, that they are there to solve the major, not only India's problem, global problem in dealing with multi-drug resistance. So a lot of people ask us, what are you going to do with the drug you have discovered, you would out-license, so and so forth. And my perception is, maybe I may be right, I may be wrong, but I believe I know enough of this area. If Big Pharma has today have no research program worthwhile, and they have cut down over the years, my assessment is whatever residual business they have on antibiotic, my assessment is there will be no business they would want it. For simple reason, then they believe that it is not commercially viable. And today it is even more so not commercially viable. Because of new therapies coming in terms of genomics, in terms of biologics, and all your new drugs are coming in that space. And it's a tough call because unlike other diseases, if you have a good drug, doctor will start using immediately. Antibiotic, they reserve a good drug till the last. Because if nothing works, that's the kind of, not phenomena, that is the right thing to do also, because why would you use a very effective drug when other older drug will work? So from that context, it's not a very viable for 50 and 100 billion or $20 billion product. These are in $1, $2, $3 billion product, maybe more, but not that. So therefore, we are looking that if we can do a research program over last years where we started from knowing nothing and build up this ability and capabilities of the organization and the belief that we can do it. To build a business organization is a much simpler effort on a global basis. And we see a wide space. We don't see too much of competition because no one has the capabilities, and all the new drugs which you have seen, which have come in last 10, 15 years, was not the original research program of the Big Pharma. They were all in-licensed product by small boutique here and there. So in terms of total capabilities of research and development, I think we are in a very nice competitive global position, and that is what we want to build up. And this is what we want India to be, we would be proud and India to be proud of over the years. The very fact that we just filed for Zenith FDA, it was our first filing in NDA. Nobody has done it. They take 60 days to accept the file. That's the norm. And our got it filed, the first file accepted in time. And we should be getting, and I hope we will get the approval sometime middle of year. Even European authorities, even before we file it, where our team was in discussion, and it got accepted as an accelerated. So I have been given one more minute to simply to conclude that I think what is important is that you need from India to move to what we talked of this today's aspect of research and innovation. You need to set create a belief first in business that it is possible to do research and succeed. And when we are looking at either quarterly or annual performance, some of us must reserve some part of resources for a long-term sustainable area to make a difference. Why in 90s about 4 or 5 of us thought that drug discovery is important? Because that is the basis of our industry. Long-term survival, long-term creating value, long-term helping the society, because every time we are the one, we contribute a very significant part of the society in terms of, and if you look at the lifespan, at the time of our independence in India, it was about 30 odd years. Today it is nearly 70 years. And that has happened worldwide. So if you see the greatest impact anybody has made is our healthcare industry, pharmaceutical, medical, everything put together. So that is where we have changed the life, and that is what is happening today. And we have a great opportunity as an industry globally to bring about further change, further improvement. And at one time, 70 was considered old. Today, 90 and 100 is considered not old. So that is the change we are in a process. And I think I must tell all of you who are in research that you must consider, because research is not something where you succeed. There are 100 failures before one success. And that is the ability one must have, that you can do so many work, but that success makes a difference. And that makes a difference to you, that makes a difference to organization. And I tell you why our people have stayed more or less intact over the last 25. Because many of you knows research, and all of you know, people spend lifetime doing the research work in drug discovery. Very few achieve a fulfillment of finding a drug. More than 90%, 95% people spend 30, 40 years of your life finding something new, and nothing happens. So you can believe at the level of motivation an individual working in the research organization achieves when what they plan to do succeeds. Thank you very much. Pleasure having you.